Hi guys, Shari here with Chic Home Style. Thank you all for joining me. Today I'm going to be talking about my very first chemo treatment infusion and my experience. If you haven't already subscribed, please do so. Hit that subscribe button, the like button, and turn on those notifications. I'm going to be documenting my journey throughout just to give you guys a little bit of feedback for those of you that might just be interested, or those that might be going through it, new to this process, and just wanting to gather a little bit of insight about how my journey has been so far. I'm gonna link my very first my very first series, I should say, and a look at my diagnosis, so you can catch up there if you haven't already checked it out. But today we'll be talking about the first experience that I had with my chemo infusion. I was extremely nervous, to say the least. I had so much anxiety, so much stress. I was overthinking the entire process. What are my symptoms going to be? Is it going to hurt? How is it going to be, accessing my port for the first time? Like, I had so many questions and so much anxiety and fear of the unknown. So my process was actually amazingly easy, to say the least, at least from my experience. My appointment was scheduled for 8:15. I checked in and we pretty much got in right away. You check in, well, at least at my hospital, you get checked in and they take your vitals, your weight, your blood pressure, all that good stuff. And then they go ahead and get you settled into your suite. So at my particular hospital, we have private suites, which is really, really nice. You have everything that you need in your suite, and they can kind of close it off with a curtain, so you have privacy, and you're allowed to have one guest. So my husband came with me for my first one and will be going with me for all of my future appointments. You get introduced to your nurse for that day. So my nurse was amazing, and a lot of the other nurses, the managers or the head of the oncology department, and a couple of nurses I had already met. So they stopped by and said hello, made me feel a little bit more comfortable. I had taken an Ativan that morning to just kind of help with my anxiety, to help just take the edge off. I was very, very nervous, extremely nervous, and they did a great job with taking care of me. One thing, I think to remember is that they are your team, they are your people. They are here to help you feel as comfortable as possible, to make things as easy as possible for you. So don't be afraid to tell them what your fears are. Don't be afraid to talk to them about whatever issues you are having. And they're always likely to make you feel more comfortable, to give you a solution, and to talk you through every single step of the way, so that you're informed and you know what's going on. For me in my process, the very first thing they did was access my port, which was the thing I was most afraid of. And typically you would have the option to do a numbing cream, but for my hospital, they do not prescribe the numbing cream for your very first appointment. Reason being is because they want to look at it. They want to make sure your incision's fully healed. They want to make sure that it's not open, and that by you putting cream on it or something on top of it could, possibly get it infected, that sort of thing. So they want to get a good look at it first. So for my first appointment, I did not have a numbing cream. So that, I was really freaking out about that. So they walked me through it, and it was a little bit more intense than, for me, than like a IV in your arm or in your hand, because the sensation's a little bit different, but definitely not anywhere near as horrible as I thought it was going to be. It's actually really quick. So once they stick the needle in and everything, and that's it. They use that same line for everything the rest of that day, so they don't have to re-stick you again or anything like that. The first poke that they do, they take your blood work. So it's very important because the blood work and your vitals that they collect for that day are actually used for the pharmacy in your dosage. They make your dosage that day. And the reason being is because as you go through chemo, things will change. Things will change with your blood markers. Things may change with your weight. You may have had certain side effects and they want to, pull back on certain, pre-meds or that sort of thing. So they want to make your pre-meds and your chemo dosages that day. So they pull your blood work and make sure, that you're good and you're cleared to receive chemo that day. Now, they pulled my blood work, and that takes about 45 minutes, I think, for them to get the results back from that and to clear you. Once they cleared me, they had one of the head guys come down from the pharmacy department, and he talked to me for about 30 minutes about possible side effects of the medications that I was taking, and he answered any questions that I had. It was extremely important because I had a lot of questions. Being that one of my main concerns was side effects and what to expect, what are, the possible pre-meds that I'm going to be getting, what are possible side effects of those pre-meds, and then also, too, for the dosage of drugs that I'm getting, what are possible side effects of those. So we talked about that extensively, and he was patient enough to answer all of my questions. So the two drugs that I am receiving for my chemo are carboplatin and gemcitabine. So those two, he explained to me a couple of things. The two particular drugs that I am receiving are not known to have a major side effect of nausea, maybe just a mild side effect of nausea, but everyone's different, of course. They did give me two pre-meds of nausea medication, one being a longer term nausea med that would last me over the next couple of days, and then one being a short term, so that while I was receiving the chemo at that time, it would help. And I do have a prescription from my doctor, my oncologist, for a nausea medication in case I do have nausea later on down the line. I'll have something to take. So I didn't have any nausea today, nor with the infusion or later today at all. They also gave me a pre-med of Benadryl to counteract any side effects that may happen. And I didn't have any side effects to any of the pre-meds or the drugs that I took. So that was good. The Benadryl did make me a little bit nauseous, but one of the pre-meds they gave me was a steroid. So once the steroid kicked in, it was kind of hard for me to sleep. It gave me a lot of energy. It made me feel really good. Took a lot of the pain away that I've been experiencing over the past few months. So what we did in my suite, I was there for a little over 4 hours. In our suite, we have pretty much everything that we need. There's TVs, there's a little lounge bench for your guest. You have a really comfy recliner chair. We brought snacks, blankets. They give you snacks, drinks, if you need them. My husband and I actually brought our Nintendo Switch, and he's pretty tech savvy, so he was able to hook up the Nintendo Switch to the TV that was in our suite, so we were able to play it on the TV and just like clear my head, that sort of thing. But I felt really, really good during the infusion. One thing I do want to let you know, because this was something I was afraid of as well. You don't feel anything during the infusion. It's not painful. It didn't sting. A lot of people had said that you have this nasty taste in your mouth after they push the saline solution. I didn't taste anything. So, everyone is different. Maybe I will taste it, going forward. Maybe it's just a matter of how it's being pushed through your line. But for this particular time, I didn't taste anything. Also, the drugs that you get, the pre-meds, the chemo, you don't feel it going through. So it's a seamless, process in that sense. In my mind, I just didn't know what to expect. I didn't know if it would burn. I didn't know if I would be uncomfortable, or anything like that. But I didn't feel anything at all. There's no pain at all. So I was very comfortable, very relaxed. The Benadryl helped with that during the entire process. And that 4 hours actually went by fairly quickly. They keep you up to date at every, marker. When I was done, once we checked out, my nurse for the day gave me my notes for my appointment, all of the drugs that I received. She went over that with me. My blood work, she went over that with me for the day. And they go ahead and they pre-schedule your next few appointments. So you have a list of that. My next appointment will be this upcoming Friday at 9:30. I am on a 21-day cycle with this chemo plan. So what that means is I'll be receiving treatments on day 1 and day 8. So 2 weeks straight, and then I'll have 1 week off. On day 8, so my next chemo treatment on Friday, I will also be receiving the Neulasta injection, which, prompts your body to create white blood cells, to keep your white blood cells up, since chemo does take a major hit to your blood cells. So I'll be receiving that injection on the 8th day of each treatment cycle, and it'll be nice, to have a week off. I know that not everyone's plans are like that. Like a lot of people's plans are every single week, or, whatever case yours might be, but I'm looking forward to having that 21-day cycle. We will, I'll meet with my oncologist regularly through this process, and we are planning to be on this regimen for at least 3 months, and then we're going to retest, do some more scans, and just see how my cancer is reacting to the current cycle that I am on. So far, so good, for day 1. A lot of people have explained and told to me that, your first day or 2, you'll feel okay, with the steroid. It gives you the energy that you need, and it helps also to combat side effects prior. So you usually don't feel a lot of the side effects until day 3-ish. So I'll keep you guys posted and let you know how things are going for me. But I felt really good afterwards. I was able to eat afterwards. No nausea, thank goodness, so far. And everything was smooth. It was a very easy in and out process. We had everything that we needed. The next video that I'll probably do is showing you guys what I took in my chemo bag and what things we packed to make sure that we were comfortable for our stay, and just make sure that I had plenty of things to keep me entertained, to use: blankets, cozy socks, gum, snacks, and things like that. Lots of water, different things that I had in my bag to help me out. But I'll share that with you guys, and I will keep you posted over the coming days to just let you know what side effects I'm experiencing and how my process has been going thus far. Thank you for joining me. Also, make sure, like what we talked about, subscribe to the channel. I'll be trying to update videos as much as I can to keep you all in the loop on things, so you don't want to miss that. Definitely subscribe, like the video, and turn on those notifications so you don't miss any of the future series that I'll be adding. Also, if you haven't followed me, a lot of you did, come from my Instagram page, which is great. If you haven't followed my Instagram page, it's my handle is Chic Home Style. I also have a blog if you want to check that out, chichomestyle.com. So a lot of my blog entries, I will go a little bit more into depth on different things, but for the most part, you can catch those videos and get a quick little idea of what's going on, where I'm at in the process, and everything. If you have any questions, please feel free to ask me. I'm happy to answer any questions that I may be able to help on based on my own experience. Of course, like we said, everyone's experience is completely different. But if you have any specific questions based on my experience, I'm happy to help in answering any of those questions for you. I look forward to seeing you guys soon. And if you are going through this, or if you know someone that's going through this and you want to share, please do. I'd like to get as many people watching these as possible in hopes that I can help someone that, you know, may feel a little bit lost, may not know what to expect right now, or just going through it, and it's daunting. It really is. It's very scary, it's very stressful, and it can be overwhelming a lot. So hopefully this gives you a little bit of insight on my experience and makes you feel a little bit better if it's something that you're going through or a loved one is going through. But I look forward to keeping you guys in the loop. Stay tuned. I'll be sharing all this week for my side effects and things like that for my first chemo treatment. Stay tuned, and thank you for joining in.